You are listening to the
World Extreme Medicine.
The World Extreme Medicine
Podcast.
In this episode today, we're going to look at the evolution of remote and rural healthcare in Australia with Claire Arundell. So today we have the privilege of speaking with Claire, who is a rural generalist anaesthetist with a wealth of experience in the field. So she currently works across various primary healthcare and indeed hospital settings in rural and remote Australia, as well as on Australian external territories. So she's completed a Bachelor of Medicine and Bachelor of Surgery at Monash University and since earned numerous qualifications, including a Fellowship of Australian College of Rural and Remote Medicine and indeed a Diploma of Rural Generalist Anaesthesia. So in addition to her clinical roles, Claire is also deeply involved in leadership and advocacy. She is the Deputy Chair of Sandpiper Australia, which is a non-for-profit organisation supporting pre-hospital care in rural areas, and indeed serves as a Chair of the Australian College of Rural and Remote Medicine College Council. So today we delve into Claire's inspiring journey, but also explore her motivations, experiences, and indeed the impact of her work in rural healthcare in Australia. Welcome, Claire, to the podcast.
Thanks so much for having me on. First, I guess extensive isn't really a way I think of my career so far. I've had a lot of variety though, and hopefully there'll be many more years to come in it. For those that might not have heard of the term before, though, I thought I'd briefly speak about what a rural generalist is and a rural generalist anaesthetist. So in Australia, that's a specialist general practitioner that has skills and knowledge to work across the primary care setting, but also in a hospital, maybe on the wards, but definitely in emergency, and having an additional area of skill. And my additional skill area is in anaesthetics, which is a really handy subspecialty in rural and remote locations. And rural generalism is a term that's currently in the process of hopefully being accredited as a formal subspecialty for general practice in Australia. So watch that space.
Just going to actually say, Claire, and we'll get you to dig into this if that's okay, is around why a generalist, but it really mandates or indeed points to the fact that in the rural environments you almost have to be a generalist because there is no subspecialism, there is no major trauma center with all these different specialisms, and it actually lends itself quite nicely to, like you said, almost being a generalist, but also a specialist within that. So you have a subspecialism as an anaesthetist, but you're also a generalist. Could you maybe speak to just, I guess, in a way, what inspired you to specialize in rural and remote medicine, but also just some of the unique challenges of being a generalist and a specialist?
Yeah, definitely. I think I can probably speak for most GPs and rural generalists in Australia and maybe the world when I say that the most common question I get or statement is, "Oh, you're just a GP, you didn't want to specialise?" And having to kind of explain that, yes, actually, general practice or rural generalism is a specialty, and it was a 4-year post-medical school fellowship after doing some extra hospital time. It kind of blows people's mind a little bit. And being a generalist is really challenging. And what do they say? It's being a GP, you need to know a lot. Your scope needs to be so broad, but you don't need to know that much about it because you can refer to someone else. Whereas when you're a subspecialist, you need to know everything about that one topic. It is really challenging, but it's really rewarding as well because you get such a variety in your practice. And we talk about cradle to grave medicine in primary care, and that's really true in rural generalism. You get to help support a first-time parent through their pregnancy, and maybe as the rural generalist anaesthetist, I'm also helping administer analgesia for their labour, or maybe they had some retained products, and so they need to go for a surgery after they've delivered birth. But then I might see them for their 6-week check and check on their baby and get to share that moment with them. And maybe I'm identifying that their baby has some sort of musculoskeletal issue that we need to follow up in a few years' time, and help refer them to the local or not so local orthopedic surgeon or pediatrician. And then, as time goes on, maybe I'm delivering their babies and helping with palliative care for their parent who's unfortunately been diagnosed with something, and keeping them in their community. So every day is so different, and the experiences and exposures are so broad. But because of that, it's rewarding for the community and for me. The challenges, though, not just the kind of, I guess, community understanding of you're just a GP, so you can't really do much, which is absolutely not true, but also with colleagues, Rural Journalism and ACRRRM, the Australian College of Rural and Remote Medicine, which is one of the 2 specialty colleges in Australia that you can do general practice training through. It's a newer college. It's not as well known. And for people that may have only worked and lived in a metropolitan area, they might never have heard of a rural generalist or come across them. And so maybe it sounds like we're cowboys in the bush, just doing whatever we feel like, which is absolutely not true. But it's maybe breaking down that barrier of misinformation and stigma and saying, actually, here's my skill set and it's within a scope. I'm not a specialist anaesthetist that's done anaesthetic training, but I can do anaesthetics appropriately in the right setting with appropriate patients in an elective setting. But I've also got this fantastic set of skills that I can use in an emergency setting that can really help out the community. Until someone else is able to come and assist if need be, or I can pick up the phone and ask someone for help. And I guess what inspired me to do it is that I have way too many interests, and it was really hard to work out what area of medicine I wanted to specialise in the first place. And as I can explain, when I heard about ACRRRM, I thought, oh yeah, this is for me. I don't have to lock myself in a room all day and just be talking to people, but I also don't need to suffer in hospitals doing shift work all the time. I can have a variety and also feel really fulfilled in what I'm doing clinically.
To your point, Claire, actually, it is such a pivotal role in society for a number of reasons, really. But one is that fundamentally it's relationship based, and you've got this unique relationship with families and other family members where you take care of maybe the whole family. Like you said, it's a real spectrum of patient contact and patient relationship. Could I get you to speak to something you touched on there, which is quite interesting, is around the key skills and knowledge that you have to learn both as a generalist and as a specialist. Could I get you to speak to your role within the Australian College of Rural and Remote Medicine? What are some of the key skills and knowledge areas that you emphasize to students?
Yeah, so one of my roles, I guess, that I have in my spare time is working with the college as a medical educator, and that role is predominantly around supporting registrars or trainees that are in the college training program through their training. So I get allocated a bunch of registrars, and I'm with them maybe from when they start in the training program, or maybe they've moved regions and they're reallocated to me, and together I help ensure with them that they're meeting all the training requirements, which can be a little bit confusing, and also help them in relation to exam preparation and making sure the experiences that they're doing are really going to contribute to the best success for their assessments. And I guess part of it is trying to be a mentor as well. Where do they see themselves in the future? What are their interests, and how can I help brainstorm with them for a pathway that's going to really support those interests too? And skills and knowledge. I mean, there's a whole curriculum that can be looked up on ACRRRM's website, and I'm not speaking officially on behalf of ACRRRM in any way here. But really, I think it starts with the foundation, and the best registrars are ones that are really passionate about rural locations and rural healthcare and generalism as well. They've got a broad range of interests, and their skills are aligning with that. And I'm really excited to see in Australia that there's this new generation of docs coming through that really want to be rural generalists, which I think 10 years ago when I finished med school wasn't as much of a thing, or maybe I wasn't in the right sphere then. It wasn't something I was aware of. But yeah, I think the future of healthcare is in really good hands in rural and remote Australia because of all these really passionate younger registrars, and hopefully they keep inspiring medical students to do the same thing and really improve the access in these rural and remote areas, and also the training opportunities that can come with that.
So in the interview, I guess we'll walk through your role in a number of organisations, really, and we'd like to touch on your role and time with Sandpiper Australia. Could you maybe tell us more about the institution and indeed your role as a deputy chair? What does it sort of involve, and how does it impact pre-hospital care in rural Australia?
Yeah, of course. So Sandpiper Australia is a rural health charity, and it's modelled on the Sandpiper Trust charity in the UK that many people may have heard of. So just like the Sandpiper Trust, Sandpiper Australia's mission is to ensure that rural clinicians are trained and equipped to respond to local emergencies in their communities. And this is through the use of a piece of equipment called the Sandpiper bag, which really is a fancy backpack. But it's a fancy backpack that's been designed to hold equipment appropriately, medical equipment, and reduce kind of clinician error and cognitive load in an emergency situation. So the backpack folds out in a really sensible manner. It's full of pouches that have kind of standardised equipment placed in them. And the idea is that this life-saving medical equipment that's in this backpack, appropriately trained clinicians can use that in a pre-hospital setting, and that might reduce health impacts whilst waiting for, say, an ambulance to come 8 hours away. So in the UK, in Scotland, there are about 1,500 of these spread around Scotland, and it's rural and remote doctors, nurses, paramedics that do appropriate training, and then their community has that clinician in that bag, and they're also linked into the local system so that if there's a car crash, an alert goes out and that Sandpiper clinician in that rural town knows that there's a car crash 2 minutes away, and if they're available they can go and assist. Australia is a pretty big country compared to Scotland, and many of our pre-hospital services are really focused in metropolitan centres, and that's great if you live really close to a metropolitan centre, but many Australians live outside of the flight radius of a helicopter, or it takes time to get a fixed wing aircraft there, and it's important that in that setting, rather than waiting for the gold standard retrieval team to arrive, if we've got appropriate clinicians on the ground, we should utilise those resources. And as I've kind of insinuated, rural generalists and rural general practitioners, they're really well positioned to help their communities through their training, through their experience and their local knowledge. And many of them already do this, but Australia doesn't have a standardised system. One state in Australia does have one. They've got South Australia has a a rural responder network, and they're integrated into the local ambulance system, these doctors, and they go and attend scenes if appropriate. And they do training with the ambulance services as well in their area, so they know what the skill set is. And I think it's important to say that the idea is not that rural doctors are retrieval specialists all of a sudden because they've got this backpack. The idea is to do really basic, but maybe slightly more advanced interventions well, to assist the retrieval services. So maybe it's just getting access and giving really good analgesia, or perhaps it's helping with hemorrhage control, or maybe it's a bit of scene coordination when someone else comes, or if I'm on the scene, my airway skills might be more advanced and a paramedic that's just arrived as well. But creating a support network, and our future goal is that we would have a national rural responder network in Australia, and it's not just people in metropolitan areas that have that really great pre-hospital access. So as the deputy chair, I work with the rest of the board members, and the board members are all volunteers, a great group of people who are really passionate about improving rural health outcomes, including a lot of the guys that contacted the Sandpiper Trust initially to start this charity a few years ago in Australia. And so there's a mix of rural doctors, rural generalists, people with paramedic backgrounds, and then we've also got some people with more business skills backgrounds to help take us to the next level, hopefully. And deputy chair role, it's a lot of people wrangling, trying to get all the guys to attend their board meetings, but coordination and supporting the chair in getting that mission statement out and working out how we can hopefully start providing these bags free of charge to rural doctors in Australia. So we've got our website that people are welcome to check out that has a bit more information on there and some resources, and we keep adding to that as we grow. But something that we're really excited about, and hopefully there's a bit of momentum coming up with it.
So Claire, you hold a number of leadership roles actually across different institutions. Just balancing that with clinical work, how do you achieve that kind of that balance of leadership versus clinical?
That's a really good question. I guess it comes back to the kind of work that I'm doing right now, and I've got a lot of flexibility in my work right now. Like you said, I work mainly in rural and remote Australia, and I do a lot of work on remote islands, which are Australian external territories. And that's predominantly as a locum, so I can dictate when I want to work and how long I want to work for, and that gives me the flexibility to take on extra roles. And on the side, my partner and I are also slowly driving around Australia in our camper van. And we've got Starlink. So if I want to zoom into a meeting, then it's pretty easy just to set up the satellite internet and do it from anywhere. I'm pretty bad at saying no to things, though. And I think part of that comes from really wanting to be involved in the change. I've always had that mantra of the standard that you walk past is the standard that you accept. And when I see discrepancies in equity and access, it makes me really frustrated, and I could just be frustrated, or I could get involved in the conversation and start trying to make some change. But certainly the flexibility of being self-employed and the location I'm at in my career right now means that I can stage my work around the other commitments that I've got.
One of the things you said actually, Claire, is around this interplay between primary care, so more kind of just minor ailments, but also one of the things and one of the aspects and competencies that you have to be proficient at is ALS and potentially ATLS, so trauma and indeed acute medical. Could I get you to speak to how you both of kind of keep current within advanced life support training, but also just some pearls of wisdom really for others, because it's extremely difficult, I guess, like you said, having these halo events, these high acuity, low occurrence events interspersed with normal generalist and rural GP workload. How do you keep current and indeed keep your competencies current?
Yeah, that's a good question. As you say, primary care can be very low acuity events, but certainly, I'm probably not alone in having quite big events occur in a primary care setting and feeling really frustrated because I didn't have all the bells and whistles that I would normally like to have there. But it's almost like in the pre-hospital setting, you need to just be able to do the basics well. You don't need an ECMO machine in primary care to save someone's life. You need to do really high quality CPR and early defib and get some access and some adrenaline into them. But how I keep current is by trying to keep up with the standards that are there. And I'm really privileged in that I facilitate on courses with my medical college, with ACRRRM. And those courses are around advanced life support, but also some other ones that the college runs specific to rural and remote health. I still sometimes wonder what I'm doing there because I'm certainly not an expert in advanced life support and emergency care. But I remember a few years ago when I was first doing courses as like a medical student or a junior doctor, the teaching was very much that teaching by humiliation type approach, and everyone kind of got thrown into scenarios and the instructors would just look at you and go, "You did that wrong, do it again." But I find that these courses now, and not just with ACRRRM, with other organisations as well, are really focused on teamwork and communication as well as the clinical algorithm side of things. and how you approach a situation and trying to remain calm and what aids you can use. So attending and facilitating on these courses is really good for cementing my ALS approach. But then we're all human, and I've certainly had episodes after a course where I've had a brain freeze and needed assistance from my colleagues and the rest of the team, because those halo events that you mentioned, they're halo events for a reason. They don't occur that often. But doing courses often means that you do get those algorithms kind of cemented in your brain and almost muscle memory at times, which can reduce the cognitive stress. I also learn so much from anyone that attends a course. I think every time I go, I gain another pearl of wisdom from an attendee about maybe a clinical thing that they've used, or an app that's awesome in an emergency, or even just a way to phrase something to help improve how the team functions. That's really valuable. I remember one thing that I really appreciated from a course that I attended, and it was just before I started traveling around in the van with my partner, and I knew I was going to go work in some more remote locations, which was my aim. And the first location was up at the snow in Victoria, doing some alpine medicine for a couple of weeks. So a lot of musculoskeletal things, people falling off runs that they shouldn't be on in the first place, or things, lots of sniffles amongst the lifties. But I remember before going up to the snow, someone spoke about a dirty adrenaline infusion. And I was really interested by that because I knew I'd be working in places where we didn't have infusion pumps. So drawing up adrenaline into the appropriate amount of saline was just going to be really fiddly. And they said, "Oh, it's fine, just chuck a vial of 1 in 1,000 into a litre bag, and 1 drip a second. Just titrate it accordingly, but at least you've got an adrenaline infusion going." Oh, okay. Hopefully I never need to use that. But actually my first day working at the snow was the busiest day that clinic had in a really long time. Our x-ray machine broke. It was just like the day from hell. And as anyone who's been at the snow would understand, in order to diagnose fractures, you kind of need an x-ray machine. But at the end of the day, I was sitting down about to have dinner with the medical students and the other doctor, and we got a call from the ambulance team that were posted up there to say that they were driving 10 minutes down the road to a community and had a call for a cardiac arrest, and could we come and help them? And we ended up going and assisting, and this gentleman needed a lot of CPR, but the adrenaline infusion was one of the first things that I set up, and it was so simple. Took absolutely no cognitive effort to hand it off to a bystander and say, "Hey, could you just look at these drips and tell me if they stop dripping, or if it's more than 1 per second?" And I really think that that helped us get that patient to the retrieval helicopter and to a tertiary centre. So that was certainly one pearl I'm really grateful for from an emergency course.
So we're going to look at just some of the research and presentations that you have done, actually, just to get some key take-homes from some of the recently presented work you've done, Claire. But before I do that, I just want to just double click on something you said around volunteer work, which is absolutely key, because I think a lot of these boards and indeed services wouldn't run if it wasn't for the goodwill of volunteers. Could I maybe get you to speak to your experience as a volunteer and sort of seeing other volunteers in amongst the firefighting, indeed, on boards within general medical councils and indeed service delivery? But just could I just get you to speak to the wider experience as a volunteer and just the goodwill and good nature of these people?
Yeah, certainly. I think volunteering is such a good thing for the community. There's a lot of research around how volunteering and being involved in a community can really help with your quality of life and your engagement and connectedness as well. And in Australia, especially in rural and remote areas, we rely on volunteers, and I'm so grateful for the fireys and the emergency services, so SES, people that go out to lots of pre-hospital events, especially. But not just the kind of pre-hospital volunteers. There's a lot of rural hospitals rely on beautiful ladies making cakes in the cafe, or taking newspapers around and driving people to and from appointments. There's quite a big, broad opportunities for volunteering in relation to healthcare, and all of them can be really, really meaningful and help really positively impact someone's healthcare journey as well. So, yeah, I think the volunteering that I do in relation to boards and advocacy work is really fulfilling for me, because I feel like I'm representing my colleagues, and my colleagues have an opportunity to say to me what they would like me to try and advocate for as well. But outside of the medical sphere, I've been a volunteer firefighter for about 15 years with my parents' local brigade close to the farm that I grew up on. And I reckon for a few years there, our family supplied about 50% of the firefighting volunteers. But that involved a bit of training when I was still in school to be a firefighter, and then yearly refreshers as well. And although I'm not at my parents' place a lot because I'm generally somewhere else, rural and remote, I've been around the farm when there's been call outs, and it might be for a fire or a road traffic accident or something like that. And it's been really fulfilling to be able to contribute in that setting. And I think being a fire, it was about group work and communication, but coming at things from a different angle to how my clinical brain might work. So maybe more environmental considerations and risk assessment that practitioners might be a bit blind to, and very close teamwork. So that was really, really satisfying and really fulfilling. And I'd encourage anyone that is in a rural and remote area, or even in a metro area, to seek out some sort of volunteering that they can do in that regards. With Sandpiper, we've been able to link in with some volunteer crews, like the State Emergency Service, which is a Victoria-specific group. And a lot of the work that they do is going and helping remove trees off roads or off cars or houses that might have fallen down in a storm, or helping to extract people from vehicles if there's been an accident. But they're so interesting to work with, and they've been able to really help us with our training courses in pre-hospital to give realistic experiences and knowledge and share those skills around what happens in that setting in a controlled manner, which is what you always want before you just get thrown in the deep end in a road traffic accident, for example.
Yeah, no, indeed. And like you said, it gives back to you in different ways, actually. And especially as a young person, in your formative years, but like you said, even progressing through, there's so many sort of vicarious lessons you can take from volunteering, putting yourself in different crowds, different high performing teams, and just getting the pearls of wisdom from that. Claire, if we could just pivot and look at your research and presentations. I believe you presented not so long back at the Victorian Rural Health Conference on topics like medicine in the extremes and indeed medication safety. Could I get you to speak to some salient take-homes from the presentations you've given?
Yeah, sure. I guess medicine in the extremes was probably a bit of a misnomer, reflecting back on what we titled that presentation. But that was a great panel with myself and two other doctors talking about where we've worked. And so myself working on external territory, so islands that are 1,600 kilometres away from Australia, with minimal resources and obviously time needed if someone's critically unwell to get back to Australia. And there was also a colleague of mine who'd done some aid work in Vanuatu, which is not too far from Australia. And then someone else that had done some work in Antarctica. So the idea was that we would talk a little bit about how we got to those roles and what we found was challenging and what we found really rewarding in those roles, and to really showcase that although a lot of training for health professionals in Australia happens in metropolitan areas, your training could take you anywhere, and you're not confined to the city limits in any way. You can still have a really rewarding career being somewhere else. And that career might involve volunteering, and that could be for a short, medium, or a long-term period of volunteering, or it might be going down to the icy colds of Antarctica for a season, or it might be going to fun tropical islands like I've done a little bit of. But it was great to showcase there were some students there as well as junior doctors and then fellows like myself, showcase to them what they might be able to do and maybe inspire people to take a step and challenge themselves. And recently, myself and a couple of other doctors in Victoria who locum predominantly, we were able to speak at a medical student conference for one of the universities in Melbourne and showcase rural locuming as a career option as well, and how we balance that in our work and our life as well, and show the variety in the career that you can have as a rural health practitioner. And it might be as a rural generalist, or it might be as a different specialty working in a rural area. And I think those presentations have been really interesting for me. I mean, firstly, I felt that I was certainly not the most appropriate person to be doing it. But anyway, I wanted to have the opportunity to show what's out there, because when I was in med school, I just don't think I was exposed to rural careers. And you can't be what you can't see. But if you're seeing that there are opportunities outside of what the university and your mates are telling you is normal, then maybe there'll be a little spark of interest in someone's mind and they'll want to do a rural rotation in med school or in their junior doctor years and see what it's all about. And perhaps that spark will turn into a bit of a flame, and that person will start doing some more training in relation to rural health. And, hey presto, I've got another colleague in rural and remote Australia. So.
No, that's fantastic. This next question is a little bit unfair, but because you've got such an array and spectrum of experience, Claire, but I guess it really is just looking back. Could you maybe speak to maybe one of the most significant achievements in your career, but also maybe just one of the most significant challenges as well? Just give us a contrast of one of the most significant achievements versus one of the most significant challenges.
One thing that comes to mind is actually getting my fellowship. It was a really long road. And like many other doctors and anyone in any career, I had my fair share of imposter syndrome. So I felt like I was climbing that mountain forever. But with that, achieving my fellowship, there was a lot of freedom that came with that too. With the ability to work wherever I wanted to in Australia and perhaps even overseas with reciprocal fellowships in other countries. But now that I've had my fellowship for a few years, I guess my achievements and the things that make me really proud are more the little things, and it's maybe more about the impact that I can have for people are the little wins. So it could be, for example, helping treat someone at home. Maybe when I'm working on Norfolk Island, it's preventing someone from having an unnecessary retrieval to Australia when there might be some interventions I can do on that island to keep them there with their family and in their community with their supports, rather than away in a hospital that they don't know with doctors that they are unaware of or maybe don't trust. Avoid a 3,000-kilometre trip. And maybe other wins, advocating for patients and their wishes and helping them navigate the system, or diagnosing a condition that suddenly has a massive positive impact on someone's life. I think those are probably the highlights now. And I think it's okay that the highlights aren't big, crazy things. We should be getting these little joys as well, because even if it is a little joy for us, it's probably a huge joy for the patient and their family. So those are probably, my now highlights. The challenges, I haven't talked much yet about how I got to where I am career-wise, but I've had a few challenges like anyone. I'm a young-looking Caucasian female, and I'm very short. I look like I could probably still be in school. So I've had my fair share of patients thinking that I was just there on work experience rather than the consultant looking after them, and that's all right. But I've also worked in some workplaces that didn't respect me or my gender or my skill set, or they didn't want to support me to become a better clinician and benefit their community. So those have been difficult. Like anyone, I've had clinical situations that didn't go the way that myself or the team intended, and they were hard to progress through. And maybe in the background of that were personal, family issues that affected confidence or my ability to kind of balance everything well. So I think a huge challenge that I have with all of that is reminding myself that I'm enough and that everything that I'm doing is enough for me and also for the communities that I'm working in. And that's really hard for me to do at times, balancing that and the imposter syndrome. But I feel really lucky to have an amazing group of mentors and colleagues across a whole lot of different fields in Australia. And they're people that I can pick up the phone and debrief to or get some support from. And so that really helps with the challenges. And I certainly think for medical students and junior doctors, but even for people in the similar career stage as I am, it's important to find your mob, find your mates that you can call and debrief to, because we need that. We're only human, and we see some crazy stuff at work, and there's only so much that you can burden yourself with before you can't continue to work anymore.
Listen, that's powerful. Powerful. Yeah. The adage of "you are enough" is absolutely key. And like you said, it hopefully quashes that self-doubt and that negative self-talk, which seems to be always ever present in everybody, really. Everyone probably has it, whether they acknowledge it or not. And it's like you said, it's countering that. But just something you've notioned towards, Claire, and it really will form the basis of my next question is, like you said, almost burning yourself out with lots of different roles or indeed lots of exposure, clinical exposure and exposure to different work ecosystems. Where's the work-life balance for you? You have notion towards the fact you do travel a lot, and indeed you see a lot of various places in Australia, but also the world. Is that your tonic to a lot of kind of workload?
Yeah, look, it probably is without me realizing it. Like you say, it's easy to get burnt out, and I've been in periods of my career where I've felt quite burnt out without realizing it. And that's probably very similar to lots of other people working in healthcare, not just doctors, but all of our other healthcare colleagues. And we have a lot of demands that are placed on us in the workplace, and responsibilities and emotional burden, and that can wear away at you. Pardon me. I guess I balance that with travel, and I'm so lucky that I can travel to amazing locations for my work and have adventures whilst I'm there. So, alluded to the fact that I go and work on Norfolk Island a bit. So I might go there for a month or a 2-month block and have weekends off and be able to go snorkel in the best snorkeling in the world, and go hike through amazing forests and really explore. And recently I went to Christmas Island for a locum as well, and did probably some of the best scuba diving I've ever done in the world. Maybe we should take that out of the podcast, because I want to share it with people, but I don't want everyone to suddenly go to Christmas Island. But I love being outdoors, and having the time to do that in between locum work means that I can really fill up my cup on that front. Trying to balance it is great, and having some little things to look forward to. So recently I went and did a multi-day hike up in the Northern Territory in Australia with my mum and my husband, and that was something that we probably had to look forward to for about 6 or 8 months. And so even if I was feeling a bit stressed or busy in workplaces, like, that's okay. The hike's only just around the corner, and it's going to be worthwhile. I can get there. And similarly, we've got a hike booked in a couple of months back in Australia as well. So that'll be fun. I think, though, work-life balance is really important, and it's probably not discussed as much when you're a student or a junior doctor. Certainly in some specialties, you can see that emergency medicine is quite burdensome, because there can be a lot of shift work, or, in this particular subspecialty, you're working every second weekend, or you need to be within a certain radius of the hospital if you're going to be called in for surgery. And the beauty of rural generalism is that in primary care, obviously, there are no after-hours emergencies. If you're working in a location where there are other colleagues with you, then you can share the burden of on-call. And so it's not as onerous, but you can support your colleagues as well. And then the beauty of locum work is that I can just decide to work for a shorter period of time. And so I know, for example, in primary care, after about the 6-week mark of working full time, I'm feeling pretty exhausted. So it's nice to limit myself to that. In anaesthetics, it's a different kind of skill set and approach to work. So maybe 2 weeks is an appropriate amount for me. And having days off between work commitments is really important. And as hard as it is, trying to set boundaries between work so that, you know, I know what time I've got available to work, and whether that's clinical work or volunteer or advocacy work, and really trying to keep those boundaries up as much as possible if I know that I need some time for myself.
So looking at future goals there, and just what's on the horizon for you, both medically and indeed sort of within your leadership career, could you maybe speak to what your aspiration is, indeed, even for the end of this year? What are the plans?
Yeah, look, it's a relatively busy year. We've got ACRRM has their big conference coming up at the end of the year, so I'm really looking forward to attending that. That's in Darwin at the end of October, and I think that some of the WEM people might be there, so it'd be great to meet people in person. I've also got some courses coming up that I've been looking at doing for a while, which I'm pretty excited about, and going and doing a locum in a new location, which will be really fun. The challenges of working somewhere different and new team, but also the excitement that will come with that would be really, really good. I guess my goals are pretty varied, and they probably change every week. On the whole, I think for the future, I just want to really enjoy my life. There's a quote that really resonated with me from Heath Ledger, who spoke about how, you know, everyone always asked questions of him like it was a bit of a shopping list. So, you know, are you married? Do you have kids? Have you got a house? How's your career? Have you got a promotion? And no one ever asks if you're happy. So, you know, I really want to enjoy myself and be happy whilst I do it, and show people that you can have that balance of working in amazing locations and a really challenging and rewarding career, but also life, because that's what we're here for. Short-term wise, clinically, it'd be great to try and find a community that I'd like to settle down in. But there are so many awesome communities out there in Australia that it's a bit hard to choose. But maybe just communities that I can keep going back to regularly and have a really nice impact there, positive impact. From the medium side of things, I like to keep challenging myself to work in more resource-poor locations. I love working on islands, but maybe there's some international aid work that I might be able to do, or with ACRRM I can apply for reciprocal fellowship with a few different countries, so that might be interesting. But working somewhere where my skills can have a really positive impact would be really rewarding to me. From a non-clinical standpoint, I mean, I spoke about Sandpiper earlier. Myself and the rest of the Sandpiper crew, I'd love in the next few years to see the establishment of a national rural responder network in Australia, and for communities to start to recognise that term and know that they've got a Sandpiper clinician in their town, and that means that they're going to have excellent pre-hospital care and equity of access. And I'd like to keep on talking to people junior in their career and medical students about the careers and the rewarding careers they can have in rural areas. And maybe that will lead to more conversations about decentralising training in other specialties, making it more attractive, maybe improving the narratives at universities where it can be a bit anti-rural. You know, if you're going rural, it's just the poor cousin, or rural's just metro with trees, which we know is not the case. So it'd be nice to have some of those goals come to fruition. And then from my personal life, spending time with family and friends and exploring more locations, and being really happy about doing that.
No, that's fantastic. And I guess just to come into land, Claire, on the conversation, could I get you to speak to some advice for aspiring rural doctors? Indeed, what kind of advice would you give them in regards to a career in rural and remote medicine?
Yeah, I think I said it earlier, but the big quote that rings for me is you can't be what you can't see. So through med school, I only really knew what I was exposed to. I went to university in Melbourne, which is in the southern part of Australia, and that was a 5-year undergraduate degree. And except for maybe about 6 or 8 weeks in that whole 5-year journey, I was based in Metropolitan Hospital. And so I only knew hospital medicine, hospital subspecialties, people being unhappy about what the GP did or what the GP sent to ED. I never knew about rural generalists. And so I think if I was to go back there now, I'd want to challenge my ideas about that and not just take what someone else has said for granted about what is or isn't a good career path to have. I think it's important to try and seek out opportunities and experience something else and challenge yourself. And I had not too long ago, a junior doctor sent me a message and asked if they could come and tail me for a day and see what working as a rural generalist anaesthetist was like, because they hadn't experienced it. And I think reaching out and doing something like that is a really great idea for a medical student or a junior doctor to do. Don't discount it. And honestly speaking, working in the country as a junior doctor was probably the best thing I ever did. After I finished medical school in Victoria, it was a match system for where you go for internship, which is your kind of qualification year as a doctor. And I got matched to a town far, far away from the city, from all of my mates. No one else I knew was matched there. And at the time, initially, I was pretty distraught. But it ended up being the best thing that ever happened. It was an amazing community, a great hospital to work in. I really learned so much practically and clinically, but also about myself in that environment. And I think that really helped kind of push me onto this path for rural journalism. And everything that I'd heard in uni and from doctors working in metropolitan areas about the country being a bit crap and doctors being duds was all a lie. So yeah, see it for yourself before you make that judgment call.
Listen, that's fantastic and a great place to finish. Listen, thank you for the past hour, Claire. It's been great just to walk through your career and also some of the spectrum of leadership and clinical work you do. So thank you.
All right. Thanks so much for having me on. Really appreciate it.
Thanks for listening to the episode. Please feel free to rate, review and subscribe on whichever platform you're listening to. Please also head over to the World Extreme Medicine website where you can find more engaging content on extreme medicine webinars and indeed the collection of courses from our global network, including humanitarian, disaster relief, expedition, space, military, tactical and performance medicine. Thanks again.